Complete Health Dentistry, transforming your health for a lifetime.
Good morning and welcome to Complete Health with Dr. Mike Rogers. I'm April, your host, and today we're here to share some exciting news. Please join me in congratulating Dr. Rogers on celebrating 25 years in dentistry. Good morning and congratulations on this monumental milestone.
Thank you, April.
I thought we'd start by giving a little background on where you started 25 years ago and where dentistry was 25 years ago.
Where we started. I graduated from dental school in Chicago, and it was unique because I was in our school. I was the first dental school class that actually had to wear gloves from the first day in school all the way through the end of school.
So you're saying before you started dental school, the students didn't wear gloves?
Correct.
Wow, you're ancient.
Thanks. And then dental school taught you the basics. It taught you how to do very basic techniques on how to treat patients and treat dental disease. It really didn't go much into treating the whole person or getting more than just fillings and things like that.
So by basics, you mean like extractions and just the silver fillings?
Extractions, silver fillings, some tooth-colored fillings for the front teeth, caps. Caps were different. We used to do different type of caps. Most times it was what's called porcelain fused metal, which is porcelain baked on to a metal thimble that then you would put in on the person's tooth.
So those are the ones that have like that dark halo at the by the gum line.
The gum line, or you see someone with a very white front tooth. A lot of times that's a porcelain fused to metal crown on the front tooth.
Okay.
The other things that we did is, just looking back just in all these years, home care products were much more limited back then or weren't as advanced as they are now. There was a limited number of toothpastes, say, in a toothpaste aisle. There was, most people would use a toothpick for getting between their teeth. Even though floss was available, they'd rather use a toothpick. And so things like that is what we see have changed.
And the toothbrushes back then were just the handheld, non-motorized.
Correct. And most people wanted a hard toothbrush because they felt that cleaned better. But, what we've found through the years is that softer toothbrushes do just as efficient and it's less damaging.
So what about where you started, Doctor, with the practice?
We started in Honesdale 25 years ago, and we bought a home office practice where our home was right above the office. We had 3 treatment rooms in the basement, and it was easy. It was an easy commute for me. Just right down the stairs.
If I remember correctly, you were still always late, though.
Nope. Everything was totally different. We had push button phones and were instead of what we have now today. Instead of having our cell phones readily handy, we had a pager, and then I'd have to track down a phone some way to make the phone call back to the person. We had traditional x-rays where we actually had to go into a dark room and develop x-rays. So it took a lot longer to take x-rays and to look over a person's treatment. And if you had to take a second x-ray, that added to the time that you were there. Our treatment, our waiting room had this little itty bitty window, a little sliding glass window that you'd come in. What do you want? No, we never said that, but that's what it felt like. And I
remember we had dark paneling,
and we updated it. I blew out the walls, and we opened up everything in that old office just to make it more user-friendly and more friendly for people coming in instead of that standoffish kind of limited view. We had tons and tons of paper charts. Computers weren't around in the dental offices back then.
Can you talk a little about the procedures that you performed 25 years ago in our practice?
Procedures, just like I learned in dental school, was basic dentistry, extractions, fillings, some root canals, caps, mostly silver mercury fillings and some tooth-colored fillings on the front. But what it is I realized that more and more people would opt to have a tooth taken out instead of going all the way to Scranton to have other treatments done. And so it put me on a path to really want to up my game and educate myself and really drive myself to give what's best for our dental, for our patients. If you had bleeding gums or periodontal disease, most times you were referred over to the gum specialist or periodontist in Scranton. And not only did you have to travel over to Scranton for treatments for that, most of the treatments back then was some type of surgical treatment where they'd actually have to do something surgically to your gums. Sealants were really just coming out on the market and starting to help protect children's teeth. Let's put the plastic coating on them to protect them and prevent them from getting cavities on them. Insurance was really just starting to look at covering them to help us prevent them. Fluoride treatments, we had fluoride in our office that we used, and you had to sit there with the fluoride soaking on your teeth.
Wasn't that where you had those styrofoam trays?
Styrofoam trays that you would sit, and the goo would sit there for a few minutes.
And it was really sour tasting, wasn't it? Yes,
it was. And then just to kind of lead into it, as I mentioned before, computers weren't prevalent. We got our first computer in our dental office in 1994. And
not long after we started.
Correct. And we realized real quickly if we were transitioning over to computers, we needed a second one. So come January of 95, we wound up buying a second computer for the front desk.
And in 1995, that was when Joyce joined our team.
Yep.
Joyce was our receptionist, and she still is on our team today. She's does a lot more than just reception. We couldn't live without her. Funny story that I wanted to share. When Joyce came to us, she did come with computer experience from prior jobs, but it wasn't a Windows-based system as we know now, so there was no mouse. And the computer mouse was new to the computer world, but Joyce had never used it. So we had to have her play solitaire for several hours each day just to learn how to navigate with the mouse.
That's funny.
So you're listening to Complete Health with Dr. Mike Rogers. When we come back, we'll discuss the changes in dentistry and in our practice over the past 25 years. Uninterrupted, unhurried attention? Time to talk about your health, your smile, and how they affect you from head to toe? If stress-free dentistry is what you are looking for, visit Dr. Michael Rogers of Complete Health Dentistry of Northeastern PA. We believe your mouth is a gateway to overall health. Complete dental health is the first line of defense against many diseases, including diabetes, heart disease, and cancer. In his state-of-the-art practice in Honesdale, Dr. Rogers offers the care you need to look and feel your best. From preventive care to implants, sleep apnea, and sedation, this is the premier dentistry you deserve. Call Dr. Rogers at 253-5000 and schedule your appointment. Just one rejuvenating visit and you'll be spoiled.
Complete Health Dentistry, transforming your health for a lifetime.
Welcome back to Complete Health with Dr. Mike Rogers. So, Dr. Rogers, why did you desire to have a dental practice where you offer and perform all your procedures under one roof without the need to refer out to specialists?
I realized that my dental school education was very basic. and that if I wanted to do the best dental care for my patients, I had to start increasing my education.
Okay.
I also realized that my patients did not want to travel to Scranton to get dental treatment from a specialist.
That is true.
And so with that, I went into learning a lot of the specialty treatments that I was referring to Scranton for. And so as we progressed with learning all these techniques, we wound up needing to increase our size of our office because of the technologies we were bringing into the office.
We outgrew our office.
We outgrew the basement 3-treatment room building, and that's where we designed and moved to our current location. And at that point, we made the name change to Smiles by Design. Along with this, I also realized that I wanted to be proactive. I wanted to be preventative. With that all in mind, I started taking courses at a location called LVI. And to elaborate on that, I wound up learning TMJ treatments. So people with headaches and jaw joint issues, pain in their head and neck. I learned more advanced cosmetics than most people have the ability to do. I learned orthodontics and advanced endodontic, meaning root canal treatments. And so all of these I was able to combine and put together in our office. So my TMJ patients now we can offer orthodontics to help eliminate their TMJ and their bite problems.
I know I was your first TMJ patient, and you really changed my life because I lived with severe migraine headaches for so long, and you applied all of the technology that you learned, and my headaches are gone.
Mm-hmm. We in our office, we introduced the water lays to Northeast Pennsylvania. We were the first ones here in this area to bring that type of technology into this area.
What is water lays?
Well, it's a laser that would energize water. So the laser energy would increase the water, and the water would actually do the work. It could remove decay. It could do gum treatments for us. We introduced in our new office, we got rid of the old dark rooms that a lot of dentists still had back then, and we went into digital x-rays because we could see instantaneously now on the computers that we were using in the office the images that we needed instead of waiting to go into a dark room and develop it.
That was a huge time saver.
It certainly is. We started placing sealants on not just kids, but on adults as well, and to help prevent decay. Once again, we want to be more proactive and preventative, not reactive to treat the decay. We want to prevent the decay. And so that's really where our focus has been headed through the years.
I know when we packed up to move, you put all of the amalgam instruments and materials to the side and said, this isn't coming with us. Why did you make that decision?
Well, I saw through those early years that a lot of the patients with these mercury-containing amalgam fillings, because the metals would expand and contract, the teeth were cracking. And so they would need more treatment than I felt they needed because of that type of filling. So I put that all aside and I went into tooth-colored or composite restorations, which can now actually help reinforce the tooth from the inside because it's glued to that tooth structure, so it helps support it instead of expanding and contracting like a metal filling would. The other thing we do was use fluorides in more aspects than what just children at their hygiene cleanings. We use them with patients with radiation treatment and cancer treatments. We use them for patients with dry mouth. We use them to help with patients with poor nutritional habits. All of this designed to help prevent decay because our focus is more preventative than reactive. I'd rather see you in a hygiene visit than see you in a dental treatment visit.
I know there's also a product that we have at the office that you prescribe to our patients to use at home, the MI paste. Can you talk a little bit about that?
MI paste is a prescription fluoride that if you use it and you use it when you see small cavities on an x-ray, it can actually help remineralize them and prevent you from needing future dental work or future fillings. And so that's the thing. I just don't watch it. I want to prevent it from getting worse or get it bigger. And so that's a way for us to do that.
That's great. In the early 2000s, I know that brought the cosmetic era. And TV helped to promote that. The shows, the Extreme Makeover shows. So I thought we could talk a little bit about 2006 when you partnered with Fox 56 when they had their own version of an Extreme Makeover.
Yeah, I was blown away with that because Fox 56 from Wilkes-Barre came out and asked me to do the dentistry for their Extreme Makeover show that they were going to do that year. And so to me, it was an honor that they felt my ability in cosmetics and aesthetics was enough to put on TV. And so I had the luxury of helping choose a patient that we all were part in helping recreate. And we were able to enhance her smile tenfold. And she still enjoys her smile today. If you want more information, you can certainly go on our website and look at the transformation.
We have a little video of the whole summer unfolding, the NEPA butterfly unfolding. So yeah, go to Complete Health Dentistry of NEPA.com to see that. We also added more, I know you talked a little bit about the digital x-rays, but recently we added some more to that. The VodTech. Can you talk a little bit about that?
VodTech is actually a CT machine which gives us three-dimensional images. And it's the lowest dose CT machine on the market. Once again, I'm looking for the health of our patients overall, and so we can look at the jaw in 3 dimensions. We can look at a tooth in 3 dimensions, and this allows us to better place implants where we need to. It allows us to see fractured roots. It allows us to see, if we're doing a root canal on a tooth, how the nerve canals in that tooth are, and is there going to be difficulty in being able to access all the way and clean it out well enough. You can find that extra hidden root or nerve that's inside that tooth. The other thing we added to our tool belt, so to speak, is CEREC one-visit crowns. We've been doing that for years, that we can, if someone needs a crown, we can do it in one visit instead of waiting 2, 3, 4 weeks to get
no
back.
Messy impressions, no
right.
Temporaries. They leave that day with it.
With the permanent crown, exactly, because our office, we can make it right there and on the spot. The other thing we found was there was still a large population of people we were missing or that I wasn't able to help. And that's really what our goal is to help people. And that population is people who have anxiety over dentistry or fear of dentistry. And so I completed training in there in oral sedation. And so we also offer oral sedation techniques where we can sedate the patient and do their dentistry. And even for patients who have time constraints and can't lose a lot of time from their job, we can do it in a lot of dentistry in one visit just by using these oral sedation techniques. Along with that, as I mentioned before, I learned orthodontics to help my TMJ patients. We also do invisible braces. We've been doing invisible braces for years. It's amazing just all these things that have come through all these years, and the changes just talking about them. It is, from implants and sinus lifts to all kinds of things that we do that a lot of people don't realize can be done in a dental office.
And I know all of your hard work has paid off. In November of 2014, you were voted Best Dentist by the readers of the Happenings magazine. And then you were voted again in 2016 and 2017.
Yeah. Thank you, Northeast Pennsylvania.
So you're listening to Complete Health with Dr. Mike Rogers. When we come back, we will discuss what your dental experience in our office will be like.
Complete Health Dentistry.
Imagine a dental office where they recognize that your mouth is a window into the health of the rest of your body. Hi, I'm April from Dr. Michael Rogers' office. We are that office. Due to our commitment to the complete health of our guests, we have changed our name from Smiles by Design to Complete Health Dentistry of Northeastern PA. We know that regular dental visits will not only help you maintain healthy teeth and gums, but help you prevent serious health conditions and maintain optimal overall well-being. Complete Health Dentistry of Northeastern PA, transforming your health for a lifetime. Call us today at 570-253-5000 and begin your path to overall health.
Complete Health Dentistry, transforming your health for a lifetime.
Welcome back to Complete Health with Dr. Mike Rogers. We've discussed where dentistry was 25 years ago. We've discussed changes we have seen since. One thing that we haven't talked about is our name change to Complete Health Dentistry of NEPA. Can you tell our listeners why you decided to change the name of your practice?
Well, through the years, April, we've developed so many things that we do in our office. As I said, from TMJ to orthodontics to sleep apnea treatments. We screen oral cancers as well, not only traditionally, but with a product called a Velscope. It's a light that illuminates and can show us early stages of cancer developing. We do non-surgical perio treatments to help, so you don't have to have your gums trimmed. So all of these things, what would happen is we would talk to people on the street and people would say, well, I didn't know you did that. I didn't know you did this. I didn't know you did that. We only thought you were cosmetic, that you did smile enhancements and just treated patients to make their smiles pretty. They didn't realize we did everything. And so what it was I decided to change our name to give us a more broader, so people could see us and say, hey, you guys do more than just cosmetics. Cosmetics is part of our practice, but we do so much more. Right now, we help children prevent bedwetting or stop bedwetting. We help them growth and development, all with just teaching airway and opening the airway so the child can breathe. There's so many things that we do, and I think now Complete Health gives us that aspect or that venue that allows us to really express who we are, that we do more than just fillings, caps, take teeth out, and some other stuff.
Can you elaborate more on the periodontal treatments? I know we have some treatments that patients can do at home.
We've got, as I was mentioning earlier, a lot of non-surgical periodontal or gum treatments. With the technology that we've learned through the years and all of the stuff we've been doing, we realize that the gum problem can relate to other health issues: heart attack, stroke, diabetes, cancer, Alzheimer's. And so our focus is, let's address that bacteria that's in our mouth, leaching into our bloodstream, called an oral bacteremia, and creating or promoting these problems, these other health issues with our patients. And so if we can back that out, it's easier for your physician to treat that systemic illness. So we've got systems in our office, we call it adaptive therapy, that can help you eliminate the bleeding gums. It can help you reverse the gum problems and the bacterial problems in your mouth. And it's non-surgical, so it's very easy to do at your home, in your home, and it's a combination of what we do in our office to help you and you taking charge at home to treat this problem together. And together we're working and finding great ways to help our patients benefit from this.
What are some other comfort measures that you use in your office?
We have warm neck wraps, we have warm blankets, we use aromatherapy and essential oils to help soothe and relax patients. We use nitrous oxide in our office to help, which is laughing gas. We use that. We also use it's called a stay or the wand. It's a micro anesthetic solution where we can dispense anesthetic using computer chips. So all of these things are to help relax.
What's the purpose of that?
One, it can anesthetize just the individual tooth. It's not as intimidating with say, a traditional injection from anesthetic. And so it can help benefit people with anxiety and still help us get you just as profoundly numb.
Can we back up a little bit? The periodontal treatment, you were talking about bacteria. How do we test for this bacteria?
That goes back to what my focus is, prevention more than reactive. And what we do is we test it in two ways. We test it in the fact that we can take a plaque sample right there in the dental office and put that on a microscope slide. And while you're standing right with us, we can look at the bacteria in your mouth and we can discuss the bacteria that we see, how that can affect you, how it's causing your gums to react, and how's it causing your mouth and your jawbones to be treated by that. We can then discuss how that could be compromising your overall health. You know, we've got this thing where we look at it as a focus shift. Our focus shift is on patient education. We really want to educate the patients so that they're fully on board with what we're trying to do and that our main goal is them. Our main goal is to help them stay healthy, to help them live a long, happy, healthy lifespan. And so
we're adding life to their years.
Exactly. And so our goal is for you to live a long, happy, healthy life. We can eliminate or decrease the periodontal impact, that the gum bacteria impact it has on us, and we can eliminate the impact that these same bacteria have on our teeth, our jaws, and our gums.
So I wanted to mention just a few upcoming things that are very exciting for us. We are going to be having our annual Halloween candy buyback, and that occurs right after Halloween. So if you join us this fall for that annual buyback, we buy your child's candy back from you. If you ever have a bowl of candy that sticks around forever, and I know I will pick at it myself, and you want it to just disappear, bring it into the office and we will pay you $1 a pound. And we take that candy and send it through Operation Gratitude in care packages to our troops. And of course, we do include toothbrushes and toothpaste with that. And then also join us on Thursday evening, November 29th, at our annual holiday open house. And this year we will be celebrating that 25 years in dentistry and also celebrating you, our patients. And we will be announcing a new contest that we're going to be doing, a follow-up to 2006's NEPA Butterfly. Our office has decided to do a New Year, New You Extreme Dental Makeover contest. So stay tuned for details on that.
Awesome. So to get back, our practice has morphed through the years from just basic fillings and dental treatments to treatments that can help you live a longer, happier, healthy life. Starting at a young age, 2-3 years old, we can start help breathing and eliminate dental needs in the future. If there's problems, if you see problems, if your gums bleed, if when you brush or floss, if they're red or swollen or puffy, if you notice them loosening or separating, these are signs that there's something going on in your mouth. Over 70% of adults have some form of gum disease. If you want whiter teeth and fresher breath, we look overall at everything. We're not just looking at just your teeth. We're looking as you as a whole, total being. And so give our office a call, 253-5000. If you want to be treated in a different fashion, in a different manner, and then just in and out for a dental appointment just because that's what the insurance covers.
And give our office a call. You've been listening to Complete Health with Dr. Mike Rogers, where we are transforming your health for a lifetime.
Complete Health Dentistry, transforming your health for a